Hello, guys. Good day. This is Anna of Reinforced Week Club. Today, we are going to talk about measles. I have seen it on TV that there is an outbreak of measles, and of course, it still remains to be a common communicable disease in the Philippines. It is common in the Philippines because we have low coverage vaccination areas as well as education on parents and families on secluded part of the Philippines. Now, measles remains to be the leading cause of death among children globally, according to the WHO. And its most intense viral transmission happens during late winter times as well as springtime. There you go. In developing countries, it is common among adolescents and adults. Case fatality of measles is high in infants aged below 12 months. Malnutrition and immunodeficiency condition are high risk of complications or even death. Measles is a highly contagious viral disease of two types. Number one is the rubella virus. Number two is the Rubeola virus. These two types of measles can be transmitted via droplet, except with the Rubeola virus, the classic measles. This type of virus, always remember, does and can able to exist in a closed environment for 2 hours. Like for example, an infected person will get into a closed room. The virus can still be alive for 2 hours in the air of that room. So be careful. Rubeola virus is also airborne. So in the hospital, managing this type of measles is airborne precaution. Now, speaking about rubella virus or the German measles, it is actually called as German measles because it was discovered by Frederick Hoffmann, a German physician, last 1814. So from then on, it was noted as German measles in the German medical literature. Now, this type of measles is actually characterized by mild maculopapular rash, accompanied by joint pain with slight fever. The rash actually starts on the face. So your face starts to become reddish, plus your neck. And then within 24 hours, the rash will spread out all over your body. I had this German measles twice. So it actually it started on the neck for me, and then within 24 hours it spread out to my tummy and my back, and on the second or third day around that time it went down to my legs, both extremities, and on the third day it's gone. And I've experienced joint pain, which is yeah, true, and fatigue, plus muscle weakness. So within 3 days, this is also called a 3-day measles because generally people who've experienced German measles, they were able to recover in 3 days time, but the rashes will last up to 5 to 8 days. This is a mild type of measles, but really dangerous for pregnant women because in the early stage of pregnancy, the virus will attack the fetus, leading to miscarriage, stillbirth, or multiple congenital defects. However, in general, this type of measles is mild and self-limiting or self-recovering. When it comes to treatment, there is no specific medical management for German measles, only symptoms related intervention. Like if you have fever, you can take antipyretic drugs, keep yourself hydrated, and of course, isolate to prevent the spread of the disease. The best way to avoid this is by vaccination, the MMR, measles, mumps, rubiola containing vaccine, which will be received by children between the age of 12 months, and 15 months for the first dose. And for the second dose, they can able to take this between 3 and 6 years old. The second type of measles is caused by Rubeola virus. It is also called as the classic measles. So this type of disease has four clinical picture or clinical presentation. The first one is the incubation phase. It happens from the time of exposure wherein the virus gets into the body via respiratory route and then it spreads out in the nasopharyngeal and lymph nodes in 2 to 3 days from the exposure. So after 2 to 3 days, in 1 week or 7 days, the virus spreads in the bloodstream. That's what we call viremia. So at this phase, the person doesn't feel anything yet. No signs and symptoms of measles. But when the second stage hits, that's what we call prodrome, it is the phase in which the signs and symptoms starts to show up, like cough, runny nose, conjunctivitis, and high fever. That happens in 10 to 12 days after the incubation period. Now, in the third stage, that happens when the rash comes out, the rashes, plus the Koplik spots. These Koplik spots are very specific only to measles. So it appears generally 48 hours before the rash, the maculopapular rash. It is called as Koplik spots because it was discovered by Henry Koplik last 1896. So Henry Koplik is an American physician and a pediatrician. So he was able to see or witness this in his patient, one of his patient. Now, this Koplik spots is present in the palate. This spots looks like grains of white sand on hot red background. Now, after this series of rashes and Koplik spots plus conjunctivitis, this is actually a much tougher virus compared to the German measles. So if the body can able to survive in the entire viral infection of Rubeola virus, that's the time when the recovery phase appears or happens, shall I say. Otherwise, if there are other complications coming out from the measles itself, that is where the medical intervention focus. It's symptoms related management. Like the person or the patient can able to take antiviral drugs or antiviral topical medications for the skin, antipyretics for the fever, and fluids for hydration if really needed, if it's necessary. Also, don't forget to isolate to prevent the spread of the virus. Such interventions are intended only to assist the body recover from the viral infection. Now, how does the healthcare provider diagnose measles? The first thing they do is the thorough assessment, physical assessment and history taking. Other GPs might going to take a blood test, which is antigen specific blood tests, IgM, IgG by ELISA method. The best way to avoid measles is by prevention, once again, taking the MMR vaccine. For kids, they can take it between 12 and 15 months old for the first dose, and for the second dose, they can take it between 3 and 6 years old. Now, the underlying complications for measles are diarrhea, otitis media, and encephalitis, viral encephalitis, the worst when the worst comes to worst. And this is common, once again, for children less than 5 years old and adults. Now, speaking about the MMR vaccine, there are a couple of contraindications for this particular vaccine. Number one is when you have severe allergic reaction to the vaccine. When something happens, something terrible happens to you in the first dose. The second one is if you are severely immunocompromised, like those people who have HIV. And then the third one is this this MMR vaccine is contraindicated if you are receiving a systemic high corticosteroid therapy for other underlying disease. Lastly, you cannot able to receive this vaccine if you are pregnant. By the way, I almost forget. You cannot also receive the vaccine if you have a family history of congenital or hereditary immunodeficiency first degree relatives. Simply because this particular vaccine is live attenuated. So this is a weakened type of germ which will be injected to the body. If your body is not strong enough to fight this weakened germ, it will kill you. So that's it for today. Thank you very much for listening. This is Anne once again of Reinforce Me Club telling you, you never lose, you either win or learn. Have a lovely day ahead.